In the news tonight, COVID situation likely to worsen. Vaccination drive begins in Lambasa. And businesses warns against price gouging.
From the studios of FBC Suva, Edwin Nunn.
Pulau Fiji. A 4-day curfew along the Suva-Nosuri corridor kicks in 4 hours from now. Government agencies have been busy planning security measures, emergency services and various other requirements throughout the restriction period. The Fiji Police Force will be leading efforts on the ground to ensure Fijians in the Suva-Nosuri corridor comply. Josiah Nanunga was at a police briefing earlier this afternoon and joins us live now.
Yes, Edwin, following the media briefing with the Acting Commissioner late this afternoon, we can now assure that the force is fully equipped and well mobilized for the effective execution of its operations plan over the next 4 days of curfew within the Suva-Nosuri corridor. And we are thankful that I'm joined by the Acting Commissioner of Police, Rusete Tunrabu. Sir, thank you so much for your time. What are some of the areas that police will be on the lookout for over the next 4 days, particularly in the Suva-Nosuri area?
Yeah, we'll be concentrating on densely populated areas, residential areas as all known by us, and also on the non-formal settlements that we are in. We will also be on the watch for some of the places where normally youths normally gather. And see, these are some of the areas, apart from the containment areas that have already been contained. We'll still have to mobilize and then try and have reinforcement in trying to get the people that are already there to remain in their containment areas. So those are areas of interest that we will be organizing, both on foot and also on mobiles. And we also will be using our drones just for the safety of people to remain where they should be.
So your assurance to the public, with increased police visibility in targeted areas and with, enough manpower who will effectively execute these duties?
Yeah, I am urging the members of the community to assist us as we double up in terms of our manpower, the visibility on the ground. This is for the safety and the security of all of us. And it also to support the main target of the Ministry of Health and the government is to stop, arrest the flow of this virus. So in order for us to do that, we'll be providing that visibility on the ground, just to see that people remain in where they should be. That's the ultimate aim of our presence in the next 96 hours of curfew.
So lastly, your advice to the general public who are watching right now, on the need to strictly adhere to the COVID-19 restrictions in place, particularly with parents and guardians, given that a good number of Fijians who are arrested for COVID-related breaches are juveniles.
Yeah, 724 for the last month is my concern, raises a lot of concern on how we are keeping in touch with our family members, especially the young ones. The juveniles are the very people that are vulnerable people that are now committing offenses. So I'm just urging the family members, guardians and parents, if you can look after our family members in this period. And I hope that the 724 arrests in this last month, this is so alarming, so to speak. I know that the people should be responsible. They should be responsible enough for us to see and know that this is the whole effort of the government. So I'm totally requesting and urging members of the community to assist by staying where they should be. Yeah, just stay within a bubble and remain within a bubble.
So you heard it yourself from the Acting Commissioner of Police, Rusete Tunrabu. Fijians, please cooperate with relevant authorities, stay within a bubble, stay at home to save lives as well as prevent the spread of COVID-19. Edwin.
Nakachosaya. The COVID-19 outbreak will get worse before the virus is defeated and Fiji is out of danger. This is the sobering message from senior health officials leading the fight against the outbreak, with 2 lives taken so far, and the virus isn't showing any signs of abating anytime soon. Christiana Uluwai reports.
With 13 community transmissions, the number of unexplained infections are rising day by day, meaning there is no link to how people are becoming exposed.
All indications are at this time that things will get worse. likely a lot worse, before they start to get better.
And we'll now quickly take you to the Ministry of Health headquarters, where the Permanent Secretary for Health, Dr. James Fong, is ready to deliver his daily COVID-19 briefing. We'll take that live now.
Mula pinaka Fiji. Today our press conference is done under a different mode. It will be, I've got cameraman in front of me, and then there's a screen that is outside of the viewers' eyes that have reporters that are zooming in. And we will be polling questions from those reporters at the end of this, at the end of our talks. Since yesterday, we've been investigating the potential for further exposure of COVID-19 in the Fiji CDC. Our medical and laboratory staff have not registered positive results at this time. However, we are in a process of deep cleaning and in decontaminating the center in line with advice that was received from the reference lab in Melbourne. As a result, there will be no testing on site for at least another 24 hours. The Fiji CDC is where we process the vast majority of COVID-19 tests. With the facility temporarily offline yesterday, the volume of our testing has decreased. Though testing had continued in Tamabua, Tumi Hospital, CWM Hospital, Lambasa Hospital, and Lotok Hospital. Based on that testing, we currently have 1 new case of COVID-19 to report. The new case is a household member of the Lakana cases reported earlier. He was already in isolation in Navo Hospital when he registered a positive result. Given that his first test when he entered the quarantine was negative, we do not view him as a high-risk case for wider transmission. The CDC handles the bulk of our testing, and we focused on bringing it back online as soon and as safely as possible. Regardless of the temporary lull we expect in swab processing, it remains vital that we use the next 4 days to identify and swab the contacts of existing cases in Suva and Nosori. That is much easier when we know everyone is securely at home. And until we have a clear idea of the extent of transmission in the Suva-Nosori area, this lockdown serves the dual purpose of putting a firm halt on further spread. There may be a community case we do not know about. Keeping these potentially positive people at home is the safest course of action. So the lockdown of Suva and Nosori is still scheduled to begin tonight at 11 p.m. and end at 4 a.m. on Wednesday, the 19th of May. We're going to use that window to trace and swab. Those are the marching orders of ministry-wide. Trace, swab, repeat. These swab results will go for processing at our operational testing sites until the Fiji CDC is fully back up and running. The results of that exercise will inform our next steps. So at this stage, we have not made a recommendation either way on the lockdown measures, whether it will extend to other areas or whether we will lengthen the duration. That will we will make at the end of the testing that we have done, and that will come as we come closer to the end of this current lockdown that we established for the first 4 days. If you're living in the Suva and Nosori and you find yourself feeling unwell at any point through the next 4 days, call 158. A team will visit you, or you may be referred to a screening clinic. Travel is permitted for medical emergencies. We have made that clear from day one of this outbreak. So anyone can receive treatment if they need it. That has included kidney dialysis patients who need to travel to receive life-sustaining treatment. The Ministry of Economy has announced the details of food ration delivery during the lockdown period. From this Sunday, the 16th of May, at noon, Fijians living in Suva and Nosori who genuinely require an emergency food supply can call *161#. *161#. That's the number to call if you need food supply. Applicants must provide their name, and other details, including the street address. As the Ministry of Economy has made clear, requests received before 12 p.m. on the 16th of May 2021 will not be registered. For the rest of Viti Levu, the new curfew hours from 6 p.m. until 4 a.m. come into effect from Saturday. Our regular advice applies as always. Wash your hands often and well, wear a mask, and maintain physical distance if you have any essential reason to leave your home. And also make sure that you have the CareFiji app installed with Bluetooth turned on. For most part, you should be at home as well. Stay home. Home is where heroes manning the hospitals, health centers, guarding containment area borders, running tests at CDC and other laboratories all wish they could be. Instead, they are working to keep us safe. Honor that sacrifice. Stay home, save lives. For Suva and Nosori, this lockdown must be decisive. It can be if everyone cooperates. The Fiji Police Force will be enforcing the stay-at-home order on the streets. But the police cannot be in every community. They cannot stop every needless and potentially deadly interaction between different households. Only you, those living in the Suva Nosori area, can hold yourselves accountable for every hour of every day of this lockdown. I'd bet that some of you will receive a call or a text asking you to come out, hang out, or otherwise just to violate the lockdown measures. Don't do it. I'm telling you now, those asking you to break your bubble do not really care about you. They certainly do not care about the country. Ignore them, please. If you see gatherings of any size, report them. Those meetups can wait until they no longer put lives at risk. Keep your bubble small, keep yourself safe, keep the faith, Fiji, in science and in each other. Thank you.
Thank you. Good evening. As the Permanent Secretary has just announced, we have one new case to report. We've also got 5 patients who have recovered. This means there are now 48 active cases, 6 are border quarantine cases, 29 are of local transmission, and 6 are currently under investigation. 13 are under investigation, and we consider them community transmission cases until proven otherwise. So now Fiji has had 166 cases in total, with 114 recoveries and 4 deaths since our first case on March the 19th, 2020. Due to the temporary shutdown of Fiji CDC, we do not have the most recent testing data available. As Dr. Fong has mentioned today, we're going into a period where a lot of you will be asked to sacrifice. It's a complete lockdown for the areas that were mentioned. Dr. Fong, myself, Dr. Chemesa, we're just 3 of thousands of healthcare workers and other workers in other areas, such as the discipline forces, who will not be able to stay home, who will be out there working to protect all of us, working to stop this outbreak. So we do ask, as we've asked every night, that if please do your best, please stay home. Don't leave your houses unless you have a medical emergency. Please do this, please help us get this outbreak under control. Thank you.
Good evening. So today is day 29 of the current outbreak, but the health services continues throughout the country. In the Western Division in Lautoka, the services that have been put in place are progressing well, and we're happy with the services that have been provided. Lautoka Hospital continues to operate as the COVID hospital. and has continued the screening of the 317 staff at the hospital with no new cases, as well as the 207 patients that are currently admitted at the hospital, which includes 51 mothers and 46 babies. The FEMAT hospital also is in full operation to date, and the team are also looking at the need and the demand from the population of Lautoka on the FEMAT field hospital, and there are consideration for increasing the scope and the capacity of the hospital. Our screening and contact tracing work continues. We have reduced the number of stationary screening clinics that we currently have operational to better focus our effort and our attention. So we currently have 55 clinics that are operational, and these sites are always updated in our website and periodically in the mass media. In the last 24 hours, 5,121 individuals who were screened at the stationary clinic, of whom 556 were swabbed. In the mobile community screening currently carried out in the main population centers in nearly all provinces in Fiji, 25,152 individuals were screened, and 1,205 individuals was swabbed, which gives a total of, to date, 413,678 individuals screened through the mobile screening clinic, and 12,050 swabbed. In our community isolation facilities, we currently have 86 individuals in 3 community isolation facilities. And as I've stated before, these facilities have positive cases and are therefore out of bounds to the general public. This weekend is about focusing on our home bubbles. We're requesting families and individuals to make every effort this weekend to protect your home bubbles from the virus by not letting anyone who does not reside in your home to come in. While at home, strengthen the practice of COVID-safe measures with your household and make that a priority. Talk to your family members about the do's and don'ts of COVID-safe practice. Download educational videos if you can, and learning materials from credible sites such as the WHO website, the US CDC website, and the government website on how to safely and correctly practice COVID-safe measures. Example, the correct way to wash your hands, the correct cough and sneezing etiquette, how to make proper homemade masks. Teach younger members of the family on what a bubble means and who should be the members of your home bubble. These measures will come handy at the other end of the lockdown, as they will protect us and save us and our family members from this deadly disease. Now, Valer.
Thank you very much, Dr. Fong, and also members of the media who are tuning in on our virtual press conference. We will now open to questions. We will start with Fiji Times. Thank you, Felix.
Naka. Mula Dr. Fong.
Yo, Bula.
This is Felix from the Fiji Times.
I got you, Felix.
Before I ask my question, I just want to wish you and your team well, especially the members who were infected at the CDC. My question is this, do we have enough...
And we seem to have lost the feed from the Ministry of Health headquarters. We will continue with our news bulletin. As we mentioned earlier, the COVID-19 outbreak will get worse before the virus is defeated and Fiji is out of danger. This is the sobering message from senior health officials leading the fight against the outbreak, which has so far taken 2 lives and isn't showing signs of abating anytime soon. Christiana Uluwai reports.
With 13 community transmissions, the number of unexplained infections are rising day by day, meaning there is no link to how people are becoming exposed.
All indications are at this time that things will get worse, likely a lot worse, before they start to get better.
The fear of contracting the India variant has seen more people adopting safety measures, wearing masks, washing hands and keeping a distance.
It's really scary, but it's like fighting a war at the moment, and my advice is just to listen to the directives and the instructions given by the Ministry of Health.
I feel that we are scared. We fear moving around and even getting close to each other when we are moving around.
An optimistic Dr. Fong says that the war against this virus can be won and thousands of lives can still be saved.
Today, tomorrow, and every day. After all, for the foreseeable future, we can tell you what steps you can take to protect yourselves and protect the ones that you love. Listen often, listen well, and please adhere to every word of advice that we have to give.
It's a tactic battle against a virus that moves quickly and easily from person to person. Our efforts have also caught the attention of the International Federation of the Red Cross, which is calling on Fijians not to be complacent. Christiana Uluwai, FBC News.
More Fijians in the Northern Division are coming forward to be vaccinated as the vaccination drive continues today in Tavyuni, Mbua, Savusavu and Maduata. Hundreds of people gathered at the various vaccination centres for a chance to get their jabs. Eleanor Turangaiviu has more.
Like hundreds other Fijians, 70-year-old Mohammed Safiq just wants to be protected against the deadly virus.
I don't feel any side effects. I'm glad to be vaccinated.
Shafiq is one of hundreds who journeyed from their homes early this morning to get their jabs at the various vaccination drive centres.
I chose to get vaccinated as it is important to be protected.
Because of this virus, I want to save my family, save the Fiji.
In Lambasa, people started lining up outside of St. Mary Primary School from 8 a.m.
Well, I chose to get vaccinated because to have a healthy life in future and to be free from these diseases.
I chose the vaccination so that I can be protected and also I can protect my family and friends.
These vaccination drives are for the first dose and are a continuation of the initial one administered only to frontline workers a couple of months ago.
It's for the safety of our country and us too.
We are afraid of the virus of coming over the Fiji. That's why we come over here and have the injection.
The second dose of the AstraZeneca vaccine is expected to be administered over the next couple of months. Eleanor Turangaiviu, FBC News.
The Fijian Competition and Consumer Commission is investigating several complaints against supermarkets regarding price gouging. Chief Executive Joel Abraham says his teams have ramped up surveillance in the past few weeks. Jeshulal reports.
Businesses that will be found hiking prices during these trying times will face legal action.
We have noted instances where complaints have been coming in from consumers, as well as our ground teams have noticed disparity in prices pre and post the announcement of lockdown. And where we see that these prices has been artificially increased, we will investigate and definitely charge these traders. So,
the Consumer Council has also received similar complaints.
We found certain supermarkets were selling basic food items above the price control rates. There were unavailability of certain products, and we discovered that certain food, especially the basic food items, were not on the supermarket shelves. However, this issue is present due to the panic buying that is currently going on by consumers.
Sima Shandil adds panic buying has contributed to some of these problems.
And these trader visits are being carried out to ensure that businesses, especially, the supermarkets, are not using this pandemic as an excuse to profiteer of consumers during these difficult times.
Consumers are being urged to not overstock items and plan their shopping wisely. Jeshu Lal, FBC News.
And we take you back now to the COVID-19 briefing with the Permanent Secretary for Health, Dr. James Fong.
If this can be considered, and if the health authorities are looking at this, taking into account the social issues also that matter at the moment, are you looking at utilizing the RFMF and NDMO to deliver straight up 2 weeks of rations for those who are the most vulnerable and go straight for 14 days lockdown to try to flush out this virus? Because if not, we may have a situation. I noticed you said that we should try to put a firm halt on this virus, and whether with a shorter period of lockdown would achieve that, or we go for a planned process of having a 14 days lockdown to try to flush out the virus.
Yes, I need to be again clear. Whenever we do a short lockdown like we're doing right now, the current lockdown, the main idea is to stop whatever case is out there from moving and to swab them and get them sorted out. And identify the positives, and so that we can isolate the positives. So that's just from the current log of cases that we have. We got 4 days to identify any new cases, swab, and isolate. Now, if we were going to go for a longer lockdown that is aimed at actually removing the virus or reducing, trying to eliminate the virus from Vitilevu, then I agree with you. It will require a longer course of lockdown. At the moment, we are doing this one so that we can actually understand a little bit more the characteristics of what's happening around Vitilevu. We are hoping that by the time we come down, if we need to go for a longer lockdown, we can be more pointed in that lockdown. We can be more targeted in the areas that we lock down. So this initial 4 days is a phase for us to get as much data as possible. Unfortunately, we're starting off with our Fiji CDC, what we just described. That will be sorted out. That will be, we'll get Fiji CDC back online. We will generate a lot more data. And if we have to lengthen these current 4 days, we may have to lengthen the current 4 days so that we can get all the data that we need. Once we get that data, then we can start to talk again about planning for a longer course of lockdown if it is needed, and where would it be needed. So the point is we're trying as far as possible to be as targeted as possible, because we also understand the socio-economic ills of prolonged lockdown. I mean, when I say socio-economic ill, many times we only talk about the economic ills, but the social implications of it are quite marked. Plenty studies have demonstrated to us the impact on gender violence, the impact on mental health. All those other things needs to be taken into account. So as far as possible, we want if we're going to do an extension, we want it to be pointed. We want it to be very targeted.
Dr. Fong, I have a second question. Thank you very much for that clarification. We shall look forward to the data and further decisions on that. It's in relation to Makoi. Makoi has become a red zone. A lot of cases have emanated from there. We have had some of those cases who have gone to other places where it's become a contact tracing nightmare, no doubt, for you and your team because of the movements. Are you looking at shutting out or having checkpoints in Makoi, where right now there's free movement in and out of there? And you did in Ra, in Wainitarawau settlement in Cunningham, you took that measure. However, we continue to see free movement in and out, people traveling in public service transport, walking around with masks. We had the acting police commissioner release a statement. There's some people who were caught even last night drinking alcohol in Makoi freely. What are some of the steps that you can take in relation to what I call a red zone, which is Makoi?
It's, I know what you're talking about. For us, from a medical perspective, a proper red zone that relates to COVID-19 is a red zone that discusses and identifies where the spread of disease is in terms of its source and where they are at any point in time. Now, mapping out the spread of disease within Makoi is not easy because geographically Makoi links to many other places. So calling it a red zone from the disease point of view is not an easy thing to do. Calling it a red zone from the behavior point of view, that's another thing. That's another aspect of the operation that we have discussed. We had some discussions with the police. There are what we call red zones that we have identified based on behavior. And those are the ones that will have focused policing over the next 4 days. We will actually put in place stronger measures for those areas. One of the good things about the 4 days is that it means that people don't move. We can actually start looking closely at our distribution of resources within hot spots that we consider where people's behavior just have not looked healthy enough for us. And we can actually redistribute a lot more resources over the next 4 days, and then we can keep them there to sustain it over a longer period of time. So I guess just to clarify, we are focusing on what we call high-risk areas, but the high risk is defined by the behavior pattern that we see, not by the distribution of the disease. And the police is actually working out the data on that one.
Thank you, sir. We'll now open to the questions to Fiji-san. Okay.
Bolovinaka, Dr. Fong and Dr. Elisha. My question is based on what you had mentioned in the statement. You had mentioned that the Ministry of Health would continue to swab people as we go through the lockdown that we are anticipating the next 4 days. My question is, with CDC inactive and with testing being done in operational testing facilities that are currently operational at the moment, what is the worst case scenario that the Ministry of Health is preparing for as far as results is concerned as we go through the lockdown and afterwards before we get the Fiji CDC back active again?
Okay, let me be very clear. We will get Fiji back and active again. The advice we got is that this is not CDC is not damaged beyond repair. And in fact, the requirements to get it back on track is not difficult. Right now, as I speak, the technicians who work the lab, they've turned themselves into cleaners. We ordered 50 bottles of Genola for them to go and scrub all the walls everywhere in the lab. And they're going to stay up tonight, not testing, but scrubbing the Fiji CDC. It can be fixed. We want to make sure that we can scrub it properly so that within 24 hours, by tomorrow afternoon, we can start getting our tests going again. Okay? On top of that, we do expect a consignment of test machines and consumables coming in very early next week. And those will be up in operation. So if you ask me what's the worst case scenario, The worst case scenario probably at this point in time is that we have to extend the lockdown for a few more days because we haven't completely tested some of the swabs that we need to test.
I'll just add one thing. So there are two objectives of this this lockdown that's going to start from tonight. One is to find contacts of cases, to get them swabbed, get their results back, get them into isolation. The other objective is to stop people moving, because as we know, as people move, the virus moves. So because we're having this lockdown, which is essentially a curfew, even if we're swabbing someone who's a contact of a case, and even if that result is delayed by a few days, they're still not moving. They're still isolating at home. And sometimes we say, okay, we ask people to isolate at home. When we have a few hundred people, it's very difficult for the Ministry of Health to put them all into quarantine facilities. So we ask them to home isolate. Now that we have the curfew, most people will have no choice. The policing will be much stricter. So we actually have this buffer period until early Wednesday morning, where even if test results are delayed, people will be at home. The transmission will be paused for this period of time. Thank you.
Enoch, are you done with the question? We'll now move to Live.
Thank you, Risi. Bulavinaka, Dr. Fong, Bula Dr. Alisha, and Dr. Tunrabu. My question tonight is with regards to the KFPG app in the context of contact tracing conducted at the extra supermarket cluster in Flagstaff. My question stems from the numerous not complaints, but contacts from the public about having received as many as 10 pings, 10 SMS messages from their telecommunications provider telling them a variety of things from you may have been in contact with someone that had the virus and then almost immediately know you are safe and come in for a test or call them the 158. And so conflicting messages, numerous messages. And when they call 158, the response was conflicting there as well. There's a glitch, there's a hack, that's a mistake. And then sometimes 1 hour later, no, you're in trouble, wait for us, we have to come and swab you. Can you tell us what is going on with regards to the information you're getting from the KPG app? Was there a glitch, a hack, or a mistake? Please inform the public what to do when they get these pings, as we're now calling it out in the community. Minaka.
Yep. Thank you. There is no glitch, not that I am aware of, and none of those who are running the FijiCare app are aware of any glitch. What I do know was that in the initial data that came across, we noticed that there was a lot of, there was a big number of names in the list. And a Viber message went out to everybody based on that list. I did, together with a few others, we looked through the list again and realized, hang on, let's narrow this down a bit more so that we can filter down to the 2 meters and 15 minutes of contact. And we did that. Then we sent out another message to say that we are rounding up all those who we really need. You do not need to be swabbed. We are rounding up all those who need to be swabbed. As we became more concrete with our messaging, then we were able to say, no, you don't count as a contact, and others did count as a contact. As I recall, because every time they sent out a message, I got a message to tell me this message went out. I only received 3 messages. One that you're a potential contact, then the other one to say that we were narrowing the search, and finally the third one to say that you are no longer contact, you don't need to isolate, we are going to go for those who we consider as contacts. Those were the three that I got. Of course, the text message that went to the actual context, I did not get copies of each and every one because that was about like close to about 700. So from our perspective, the CareFiji app and the way it does its contact tracing is working.
Thank you very much, Dr. Fong. I appreciate that clarification. And on that note, I would like to make a request that maybe this information be put on the government social media platforms for the information of the public. I'd also like to thank you for the response to our requests for more information coming out of the government. My second question is to do with your contact tracing and fact-finding work this weekend. Can you tell us the places that you're going to be doing your contact tracing, your trace, swab, and test, as you explained? Can you give us a list of the locations where people can expect to let your people in to cooperate and to be part of your process?
Yes, most of the work really will be situated around the Fiji Care app information that we have got, the contact traces that that were generated from that group. And there's another case in Lakena that we have to sort out the context of that group. In as far as what to expect and when to expect, a lot of that is dependent on the distribution of the contacts. And as I see it, one of the reasons why we asked for a lockdown of the Suva-Nosori corridor and we did not ask for Lami to be included was because we could see that most of them were in the Suva-Nosori corridor. And that's also the extent of the distribution that we could work out. Otherwise, the contacts are quite liberally distributed within those two areas.
Thank you very much, Dr. Fong. If I can just add another question, it's to do with we saw earlier this week that the family of a well-known sporting personality was able to leave this country, and we understand that the current instructions are no flights in or out, no traveling in or out. We're also hearing plans being made by some of our neighbor governments to repatriate their citizens. The U.S. State Department has now issued travel restrictions against Fiji. Can you tell us what is the word? Are people who are not nationals, who are not Fijian nationals, able to catch a seat on one of our freighter flights and go back home?
Thank you.
Can they organize?
The reason we did restrict, the reason we restricted travel going out was really because when anybody goes out of the country, they use up resources. First, we have to do pre-departure testing. We have to set up a plan for the police to open up the border for them. There is some people who actually need to be monitored in terms of their movement going towards the Nandi airport. So in the initial part of when I called out and said no traveling out, the intention really was for us to refocus all our resources back on our screening program. As things have evolved, I have allowed quite a few people to go out. The Serevi family was not the only family that I allowed out. There is many more, and there are many more on my table that I am allowing out in accordance to the amount of resources that we can generate to make them safely go out. When I say this, that means that in the next ensuing few days, we're going to have difficulty giving anybody an approval to go out because we are limited in terms of our testing capacity. Our ability to turn around a test in 72 hours is going to be limited. As soon as that opens up, then we start again, we're giving them the ability to go out of the country. So everything is resource-based. And everything, because it's resource-based and our resource base has an ability to change, given the escalating cases that we have, my decision will have to change as we move along. It's not being unfair. It's just that the amount of resources, the challenges we face keep changing, So I have to change according to the resource base that I have with me. Thank you.
Thank you, Lide. We'll now move to Fiji TV.
Good evening, Dr. Fong, Dr. Alisha, and Dr. Chimesa. My question is for Dr. Chimesa. Can you please elaborate on the importance and the effectiveness of the screening clinics, considering our COVID-19 patients are presenting themselves at the health centers?
I think I've addressed this question in one of our earlier briefing. This is exactly why we've set up the screening clinic, so that we can identify patients in the community who may have symptoms and who need to present to the hospital, that they do present to a place where they're not accessing the hospital directly, but it's a place where the staff are prepared, and the screening is done safely, and when a patient is identified, that they can be safely escorted to a hospital for their further treatment. So at the moment we have 55 screening clinics in the country, and we are encouraging members of the public, all Fijians who have symptoms, that they either call the number 158 or present to these clinics. We've diagnosed a fair bit of our current positive cases from the screening clinic, and we are happy that it's serving the purpose. So we are encouraging members of the public to make use of the screening clinic. They have nothing to fear from our team on the ground, and the screening clinics staff will ensure that their testing are done, and they are, if required, directed in an appropriate manner and a safe manner to a hospital that will treat them of the illness or presenting complaints. Mark.
Thank you, Dr. Chimesa. Thank you, Dr. Chimesa. My next question is for Dr. James Fong. Just in terms of the screening and testing this lockdown period, how many health officials will be going out to conduct this testing and screening, and what is the target in terms of Suva and lockdown area?
As I mentioned, I think I did mention to you that there is something like 800, 900 that we identified on the Care Fiji app in the Suva area. Stemming from the Lakena group, I unfortunately do not have the numbers with me. I know that it's in the hundreds, and that I mean they currently doing. They got a list up at with the Nausori subdivisional team. The exercise is going to be big. I mean, as I mentioned to the previous reporter, the size of the exercise is dictated by the landmass that we are locking down, and that's the Suva Nausori area. But when we just a quick look through all the information on the contact tracing app and the ones that we're receiving from Nausori, the information we're getting is that a lockdown between Suva and Nausori is more reasonable than extending it beyond that. I guess what I'm saying is that I can't give you the exact numbers, but I do know that the size of our lockdown is appropriate for the distribution of the cases that we got.
Thank you, Dr. Fong. We'll now open the mic to My TV.
Bula, Dr. Fong.
Bula.
Dr. Fong, you mentioned how one of the targets for the screening this weekend is that you're looking to have a map out a clear idea of the extent of the transmission. So what sort of indicators or benchmark are you looking at to be able to gauge that the extent of transmission, to be able to say zero in on, and map up, the extent of the transmission?
The as I said, the 4 days we got ahead is, once you got the data from the 4 days, it maps out the next steps further down the line. The 4 days is not going to stop anything. The 4 days is to gather as much information as we got to decide on longer term measures that are required to actually stamp out the virus. The only information that I've got for sure is that we have new cases evolving within the Suva Nosori lockdown areas or contained areas, and we have generated a wide variety of contacts from them. You can note that we still have not got any more new cases out of Ra, and I'm still looking at the data in Ra so that people can generate for me the screening and the swabbing data from Ra that can allow us to confidently say, okay, Ra looks a bit more COVID contained. We have done a similar exercise in Lambasa at the beginning of this whole exercise, where we did a massive campaign of swabbing and testing, and we are far more confident that the North is COVID contained. The main parameter, of course, for COVID containment is if you don't get new cases in your screening clinic. The point we're making also is that we are confident in our distribution of screening clinics and in the criteria that we're using for swabbing and testing, that it will tell us when there is no more cases in the community. And basically, when there's no cases being reported, say, for at least 3 weeks, if not 4 weeks, that gives us a lot more assurance, based on our testing capability and our screening strategy, that we are moving closer and closer to being COVID contained. So at the end of the day, the main criteria for COVID containment is the number of new cases that we generate out of our screening program.
Thank you, Dr. Pong. One other question. Condolences to the family of the deceased. This is about the lady who died in Makoi. When she presented herself at the health facility, she was in a stage where she was infectious. I understand that there were screening done in that area as well. Is there, how did the screening team miss that? Do you have cases like that happening in other areas as well?
All I can say is the screening team did get around to the household. I was told that they did get around to the household. There was no symptoms reported. At that point in time, the household did not meet the swabbing criteria. And when they presented to Makoi, yes, she was quite sick. I think, I would like to say that that is about as much information that we got about the case. I must admit, I feel a little bit nervous having to try and give more information because I do not want to throw any negative permutations around the family. I'm just happy at the fact that they were assessed previously. The family was not regarded as having any evidence of disease, and we did present 2 weeks later with severe symptoms, which was recognized. I mean, the staff in Makoi knew immediately that these symptoms looked dangerous. So all those who came into contact with the patient were all in full PPE. They actually emptied out the place even before they started managing the patient and making sure that all those who came in contact were in full PPE. And then they started managing the patient and arranging for the referral.
Thank you, La. Now we'll move to FBC, Koroi.
Good evening, Dr. Fong, Dr. Sahukan, and Dr. Tunravu. Thank you again for your daily updates with regards to COVID-19. I have 2 quick questions. First one being about the testing capacity. I understand that there are testing underway in other sites across the country. However, given the sheer number of testing that is normally conducted at the Fiji CDC, and now that it being affected, how far behind are we in terms of testing? And do you fear that this could lead to a possible explosion of cases if and when testing at CDC resumes?
One of the, I think Alicia touched on this, one of the biggest benefits of, I mean, we have no control over the fact that the testing in Fiji CDC had to stop. That is beyond our control. There is a high standard of laboratory standard that we have to maintain, and if laboratory standard is not high enough, we stop, we clean, and we'll get back online. Now, the second thing that was alluded to was the fact that because of the lockdown, we know that we can swab, we can find you, we can swab those who need, all those who are supposed to be screened. If there's a positive among them, we know that because of the lockdown, they won't move much. So it just so happens that we're having a lockdown at a time when our testing capability is dropped. But we are also confident that it's still the best thing to do is to continue the lockdown, because it also means that if we swab you, we find you, we can keep the specimen aside, get the lab back online later tomorrow, and then start testing and catching up with all the backlog. The backlog that we have, there's a sizable backlog, but we will catch up with it, especially given the extra capacity that we will be receiving early in the week.
Thank
you. Corey?
Let's have one more question. Thank you, Dr. Fong, for that response. Just quickly, with regards to the last lockdown that we have, for a weekend lockdown, rather, the Ministry of Health, together with other relevant bodies, were helping in distribution of rations. We know with the ones that will be starting from Sunday noon onwards, and for people that will be calling in and texting in their details, how are you planning to ensure that people will not abuse these?
Yes, I think the Ministry of Economy has generated a statement today that has outlined the process that is there. And I mean, one of the things that we are very thankful for is that given that the Ministry of Economy has its own machinery to assess and distribute the rations, it does mean that the Ministry of Health will only focus on testing and swabbing and containment during this lockdown.
Thank you.
Thank you very much, Pong. Thank you, Dr. Sokan and Dr. Tundrawu, members of the media. Thank you so much for.
And just quickly recapping the details from tonight's briefing. After 24 hours of testing, there is one new case of COVID-19 connected to the cluster in Lakena, Nosori. The point also being made by health officials that their testing is somewhat affected due to the closure of the Center for Disease Control in Tamavua, where the bulk of testing is conducted. The CDC is expected to open in 24 hours, at which time full testing will resume. All lockdown measures, including the 4-day lockdown for the Suvarnasuri corridor, remain in place when intensive screening, swabbing and testing will take place to find any possible cases. There are at least 900 cases that have been identified via the Care Fiji app and a few more hundred in Lakena. We will now continue with our bulletin. Reports of some church leaders breaching COVID-19 safety protocols have come to light over the past few days. Methodist Church of Fiji General Secretary Reverend Ilyasa Naivalu is disappointed with some ministers and lay preachers caught breaching social gathering restrictions. Josiah Nanunga has more.
Some church leaders have been found guilty and the police is currently handling the matter.
That has been brought to our attention that some senior ministers as well as lay people have been part of certain functions in the past few days. Some of these cases have been reported to police.
Reverend Naivalu says these actions are uncalled for, and the church continues to encourage divisional and circuit leaders across Fiji to lead by example. President of the Fiji Council of Churches, Archbishop Peter Lloyd Chong, is urging church leaders and Fijians to be responsible and do the right thing in these trying times.
This is just the right thing that we should be doing right now. Any good person should be doing this, and especially church leaders who are supposed to be example of doing the correct thing, doing what is ethically right and morally right.
The Ministry of Health has directed that no religious service be held until further notice as it works to contain the current wave of COVID-19. Josayana Nuga, FBC News.
Up ahead, Australia to provide vaccine assistance. And people resort to convenience stores for shopping. Welcome back. More resources have been directed towards main hospitals around Fiji as authorities brace for the worst possible scenario. Minister for Health Dr. Ifiremi Wangainambete says they are planning ahead as more COVID-19 cases are being reported. Apanisa Wangairandovu reports work is being carried out at the CWM hospital in Suva to standardize the isolation unit.
The Ministry of Health wants to ensure infectious control measures are in place, at the same time cater to more people.
This is part and parcel of normal work within any hospital, is to the ability to have infection control measures and isolation beds and isolation units. What we do have now is the ability to have more beds as we want to be able to ensure that COVID-19 patients that we do look after, they are looked after in the facilities, they are looked after well.
Dr. Wangainambete says they are mindful hospitals do not become a place of infection, hence measures and preparations are important.
More importantly, to ensure that we have hygienic processes for protecting those who may not have COVID-19 and also staff.
We have tactics that defeat this enemy, and we know from experience that going hard early can secure us a victory.
The Health Ministry is scaling up its measures and ensure personnel wear personal protective equipment. Relevant stakeholders, including the World Health Organization, are assisting Fiji as the nation tries to contain the spread of the virus. Apenisong Grandobu, FBC News.
COVID-19 and the resulting measures affects people's mental health and can create new barriers for people already suffering from a mental illness. The Empower Pacific mental health specialist says families across Fiji are trying to adapt to the ongoing challenges posed by the pandemic. Kritika Kumar reports.
Worry and stress over coronavirus can affect people's well-being and could lead to difficulty sleeping or eating.
As a mental health specialist, I would like to emphasize that it is very important for adults to remember that your children look up to you for guidance on how to react to stressful events.
Prem Singh says isolation, joblessness, childcare are some factors that severely affect people's mental well-being.
At the end of the day, I think all of us are feeling that particular anxiety and fear of the uncertain,
Psychologist Selina Kuruleda says the majority of people are focusing on their basic needs.
In this regard, we need to make sure that as much as possible we take care of people's basic needs first, which is food, shelter, clothing.
Singh says that people should ensure they engage themselves in various activities during the day to keep their mind off the pandemic as a coping mechanism. Kritika Kumar, FBC News.
Now, 10,000 doses of the AstraZeneca vaccine will arrive from Australia this week. Minister for the Pacific, Zed Seselja, has tweeted that he spoke with his Fijian counterpart, Dr. Ifiremi Wangainambete, and Australia will be providing further support under the Vuvale partnership as Fiji faces new COVID-19 challenges. Saselja earlier confirmed they've committed around $16 million in the fight against COVID-19. The funding is a mix of direct financial support to procure the vaccine and, where possible, sharing surplus Australian doses. The minister says they are also ready to accommodate any specific request from the Fijian government. More Fijians were spotted doing last-minute shopping at convenience stores such as service stations instead of going to supermarkets. FBC News visited some stores in Suva earlier in the day and saw people lining up with empty shopping bags. Kelly Vadala reports.
For many of these Fijians, lining up at supermarkets is not an option.
And there's no hassle, there's no pressure on you, so it's easier for me to come to the convenience store to get the groceries that I need to go back home.
We've got time management in regards to going to work. We didn't want to be late.
Others say they couldn't wait in line at supermarkets as they had other plans.
I couldn't stand it anymore because the line was so long. I had to come to the small shops and do my shopping here.
Director for Wing Shang & Co Limited in Samambulo, Suva, Frank Cho, says customers have been lining up since 8 a.m.
And we've been increasing in hours just to cater to the demand. And it's hard because there's lack of supplies coming in. Yeah, so it's just getting stock.
There were also long queues at various service stations as vehicles fuel up. Kelly Vavala, FBC News.
Coming up after the break, flood alleviation project to protect coastal communities. Stay with us. Welcome back. Now, Nandi Flood Alleviation Project will assist the Ministry of Waterways to protect 15 coastal communities from seawater flooding and erosion caused by climate change. The project is being The project is being carried out through funding from the Asian Development Bank. The project includes the building of seawalls and growing vegetation. It will also focus on enhanced planning and governance to make these communities more resilient to climate change.
The program will help water supply, sanitation, and hygiene provide greater health outcomes, including building resilience to COVID-19. So far in Fiji, this program has supported the Water Authority of Fiji to develop and test its business continuity plans to ensure minimum disruptions are experienced during different types of crises.
In an effort to assist Fijians during this difficult time, the management of Nalangi Hotel today donated $2,000 worth of basic food items to villagers of Saunaka in Nandi. It's timely assistance for the village as many are currently unemployed due to the effects of COVID-19. Felipe Naikaso has more.
It's a much-needed donation that will greatly assist the villagers during this trying time.
It's about the 120 families in the village, and at the moment it's a second wave of our COVID-19, and it's hitting us really hard. And families are struggling, and all individuals in the family are finding it difficult.
This is also not the first time the hotel has assisted Saunaka village, as for the past years they've been involved in many projects. However, today's donation is a very important one, especially for the families.
We feel the urge that we need to come back and feed back to the community and to help them to go through this very difficult period.
There's around 800 villages of Saunaka, and 85% of them are currently unemployed due to the pandemic. And with the assistance today given by Nalangi Hotel, it will go a long way for these families.
We have our farms, we have the rivers, and whatever we have, our natural, we can depend on.
The village has also set up a checkpoint with strict rules for visitors, as they want to ensure they remain COVID contained. Movement in and out of the village is also closely monitored. Felipe Naikaso, FBC News.
People from outside the containment area towards Sawani visited the border this morning to sell their fresh produce. These farmers and vendors can't cross the border and can only exchange their produce with those on the inside. Farmers came in their carriers with root crops, fresh greens and the hope of getting some money in return. Middlemen and vendors were able to purchase what they need to sell at the Suva market, hoping to earn a decent income before the 4-day lockdown of Suva and Nosori beginning tonight.
Around 118,000 households have been assisted with a payout of over $10.6 million through the $90 cash assistance program. This includes around 37,000 households in the Nandi Lotoka containment area and 81,000 households in the Lami, Suva, Nasinu and the Nosori containment areas. There were long queues yesterday around Vodafone outlets in Suva, with people already receiving government assistance. The Ministry of Economy started receiving applications from people in Lami, Suva, Nasinu and the Nosori containment areas from Sunday. Acting Permanent Secretary for Economy Shiri Gaundar says, apart from this, government has also worked together with the Fiji National Provident Fund to bring forward the Phase 2 unemployment assistance payments for 37,000 recipients. The payment was scheduled to be due next week, but this has been paid last night. Gaundar says members can access these funds today. Garbage collection will continue as normal in the Suva-Nasinu corridor during the scheduled lockdown, rather Nosori corridor. Minister for Local Government Pramila Kumar says this will ensure the environment is safe and clean during such crucial times. Kumar says all municipal councils in the lockdown areas have been tasked to ensure essential services such as solid waste management continue with minimal disruptions. She says these services will continue in line with the necessary health protocol. Here are the local exchange rates as set early this morning. The Fiji dollar was pegged higher against all the international currencies we cover, including the Aussie dollar, but lost ground against the Kiwi dollar and the Japanese yen. Prices were mixed on the commodities market. Crude oil dropped a few dollars at $63 a barrel. Gold rose to $1,822 per ounce, and silver closed down at $27.04 per ounce. We now join Sanifa from HFC Bank to give us the latest Australian dollars from the money market.
Thank you, Whitney, and good evening. The US dollar held steady near week highs after the US Labor Department reported higher producer prices in April. The producer price index rose 0.6% after surging 1.0% in March. Also, data released overnight showed the number of Americans filing new claims for unemployment benefits dropped to a 14-month low last week. Initial claims for state unemployment benefits dropped 34,000 to a seasonally adjusted 473,000, making it the lowest since mid-March 2020. All this has perhaps given traders a further evidence that inflation is rising in the United States. Now, retail sales data will be the main area of focus, expected to be out later tonight. Elsewhere, the British pound and euro was little changed, while the Japanese yen got a bit of boost against the US dollar. Otherwise, it was a relatively quiet day on the economic data. That's all from your HFC Bank for this week. Vinaka.
Despite a challenging past year, Momi Bay's Fiji Marriott Resort has won the 2021 Traveller's Choice Award on TripAdvisor. General Manager Silvano Dresino says the resort stood out by continuously delighting local resident guests, delivering fashion show events, and launching Momi Bay's Sunset Series, among other activities. Dresino says they continue to pray and hope for quicker recovery from this pandemic so they can welcome guests to experience a gateway in Fiji's paradise. And that's it from Business Tonight. We now join Jamie with the latest in sports.
Naka, and good evening in sport. Fiji football's wonder boy Roy Krishna is yet to finalize a new deal with the Indian Super League side ATK Mohan Bagan. There's some rumors about his contract extension for ATK, but Krishna is currently focusing on keeping fit and spending time with his family in Ba.
When you go for a run, try to have this distance and, just be safe at the same time when doing your training.
Fiji Football Association will make some services available for players once the virus is contained.
A huge setback. Of course, as we resume, we will be trying to get in touch with experts in this area to ensure there's enough counseling for the players, district officials, and everybody else involved in this game.
The Mba Football Association has had to make some tough decisions to keep them in operation during this period. The association, like others, have been hit hard with sports at a standstill and revenue generation close to none. Tali Matarakula reports.
The men in black have had to resort to a 50% reduction in their allowance.
We've asked players to do their own trainings, and we've reduced the allowance to 50% so that at least they get something every week to put food on the table for their families.
The association hopes things will soon return to normal.
Hopefully it doesn't go too long, because then we'll exhaust all our funds and then the officials will have to start forking out from their pockets again and looking after the team.
The Narunga Football Association is also on the same page.
We are doing whatever we can do. We are trying to collect some money from here and there and trying to support them. Not fully, but definitely we are trying to support the players.
The Fiji Football Association has also indicated that they will stand by to assist districts in these trying times. Tali Materkula, FBC Sports.
Former Fiji 7-star Vilimoni Mbotitu is starting to stamp his mark in France. This is one of the reasons his France top 14 club Castres has decided to extend his contract. The Kaiviti Silk Tails have a much-needed week off to re-strategize and recover from 8 games in the Ron Massey Cup competition. Roberto Firmino scored twice at Old Trafford as Liverpool came from behind to beat Manchester United 4-2 and boost their hopes of finishing in the Premier League top 4 this morning. The English Premier League football clubs have renewed the existing UK broadcast deals with Sky, BT and Amazon for another 3 years. These lucrative TV rights deals have helped the Premier League become the richest league in the world. In today's play of the day, Chelsea women's Sam Kerr and Fran Kirby linking up once again to dominate the English Women's Super League with a 5-0 win against Reading. That's it from sports tonight, but coming up, some pet owners will end relationships if their furry companions do not approve. Find out more in Weird and Wonderful after the break. Cloudy periods with few showers over most parts of the country today, with showers experienced in some parts of the major centers. In the west, sunny morning with cloudy afternoon. Eastwards from Pacific Harbour to Suva, mostly cloudy with showers in the afternoon. In the north, partly sunny with cloudy conditions. At sea, east to southeast winds 15 to 20 knots, moderate to rough seas, moderate southeast swells. The next high tide is at 8:44 tonight this hour, with the next low tide at 2:29 a.m. Sunrise will be at 6:24. The outlook for tomorrow: more cloudy conditions can be expected over the entire Fiji group. And for Sunday, cloudy periods with few showers over the eastern parts and the interior of the larger islands, cloudy periods with isolated afternoon showers elsewhere. And in the world of the weird and the wonderful, most people trust their pet's judgment, so much so that they are willing to end relationships if their furry friends don't approve. And recapping our main stories, 4-day curfew along the Suvarnasuri corridor to come into effect in just over 2 hours. COVID-19 situation likely to worsen, and 1 new case confirmed in the last 24 hours. For these stories and others, you can tune in daily to our sister radio station Gold FM
To our poll question, this week we are asking, has the extended school break resulted in more screen time for students? Visit our FBC News website to answer. You can also send us newsworthy pictures and videos. Email fbcnews@fbc.com.fj or share it with us via our various social media accounts, including Facebook, Twitter and Instagram. You can also download our FBC app to keep updated with the very latest in news and sports and listen to our 6 radio stations live. That's your news this evening. I'll be back again tomorrow. Until then, stay safe. Modemanda.